What's the best medicine for diabetes? Which is the most effective drug? What can regulate blood sugar levels most efficiently with fewer side effects? In this video, I'll answer that question. You often ask about medications on this channel. I don't discuss them much as I focus on controlling risk factors and promoting health beyond just medication. But I'll make an exception in this video because it's a common question. So I'll tell you the best medicine for diabetics. Promise me you won't take any pills just because you watched this video. Consult your doctor, as self-medicating can be very dangerous. I want to clarify that this video isn't sponsored in any way. I don't take money from pharma companies or have ties to labs. I don't prescribe meds or sell any supplements or drugs. If you see videos claiming otherwise, know it's false. Please report such content in the first comment. Okay? This has become a police matter, even internationally. I've taken legal action to stop this fraud using my name. I'm asking for your help with this, alright? So mention it in the first comment and let's start the video. Now, what's the best medicine for diabetes? Which one is the most effective? We have three main options, the top three. I'll discuss each briefly, then answer the question, which is the best of the three? What are the three drugs considered best currently? The first group is the pen group. Have you heard of them? Weight loss pens have become very popular recently. These meds can also be used for diabetes. What are these medications? I'll give the substance name, then the brand name. Note that brand names may vary by region or country. They are liraglutide and semaglutide. Liraglutide's brand is Saxenda, semaglutide is Ozempic. Dosage can change the name even from the same lab, okay? But these two are the most common ones. How do these medications work? They're in the class of GLP-1 analogs. Are you familiar with these meds? They increase fullness, reduce eating and weight, slow digestion, so food stays in your stomach longer. There are other effects too, but I'll keep it brief. The pen injectors are also great options. Another major option is medication that helps you lose sugar through urine. Have you heard of these medications? What are they? I'll mention the two most common ones, dapagliflozin and empagliflozin. Dapagliflozin's brand name is Forxiga or Farxiga in some countries. It's almost the same, just with an A. So Farxiga, and empagliflozin is Jardiance. That's the brand name. These meds make you eliminate more sugar through urine. They have side effects and many can't use them, but they're known for heart safety. Studies suggest they may lower heart attack and kidney disease risks. So they're also a therapeutic class to consider. Our last group has one current representative, metformin. Have you heard of it? Metformin is interesting, safe, used for decades, and by far the cheapest option. It effectively reduces blood sugar by improving insulin sensitivity. Type 2 diabetes occurs due to insulin resistance. The body produces insulin, but it can't effectively use sugar for energy in muscles. So, metformin acts on this and the liver, which is often affected in diabetes. Sometimes the liver produces more sugar than normal. Metformin works on muscles, tissues, and the liver, improving insulin sensitivity. That's why you might sleep with normal sugar levels, but wake up with high blood sugar. Have you ever wondered why this happens? One reason is that the liver can produce sugar, which is why metformin is so useful. But what's the best option, considering everything I've mentioned? First, I want you to understand my thought process. You know I focus on controlling the factors that led to the disease. But since this video is about medications, I'll share my view on that too. The first thing I look for in a medicine is safety. It's pointless to have a strong medicine that lowers blood sugar but has many side effects. There's no benefit in improving diabetes if other health issues worsen. So, safety is crucial. Second, another important factor is cost. Is this medication affordable for the patient? A good medicine is useless if it costs $13,000 per week or month. Can the patient maintain this medication long term? So cost is key. Next, effectiveness. Does the medicine meet expectations? Does it lower blood sugar levels? Does it improve glycated hemoglobin tests? Do you know what glycated hemoglobin is? It's the average blood sugar over the last 90 days. Can this drug effectively reduce glycated hemoglobin levels? What are ideal glycated hemoglobin levels? For diabetics, we aim for around 7%. Why? Up to that 7% value, you have fewer chronic diabetes complications, such as kidney disease and renal failure, like diabetic retinopathy, eye and nerve diseases, diabetic neuropathy, the most common chronic complication. So, can this medication prevent chronic complications? Can this drug effectively reduce these levels? There's another parameter: time in glucose target range. Unlike before, we used only glycated hemoglobin. Now we know about time in glucose target range. What's that? You'll hear a lot about this in coming years. Is this treatment keeping blood sugar levels in range most of the time, within the therapeutic target, with HbA1c? If you have frequent hypoglycemia, low values, the average might look good. So this isn't the only factor to consider, but these parameters help me decide on the best treatment. Now that you understand more, the American Diabetes Association recommends metformin. Metformin's brand name is often glucophage. Remember, metformin is no longer patented, so it's a cheaper medication, and other labs can produce it too. In most cases, metformin is better than other treatments. Why do I say most cases? For type 1 diabetes, insulin is the treatment, so this isn't always true. Some patients may have weak kidneys. Here, metformin may be risky depending on kidney function, but typically, metformin will be the best choice in most cases, according to protocol. Recently, especially last year, there's a push to include GLP-1 analogs as a first-line treatment, the injectable pens I mentioned at the start of the video. Remember those? However, we still have more scientific evidence supporting metformin. So don't fall for fake videos promoting pricier drugs or miracle alternatives. You know those don't exist. I should also note that besides the three classes I mentioned, many other good, validated diabetes treatments exist. I'm not against other medications at all. I prescribe them myself. Today, I prescribed a diabetes drug not on the list I mentioned, so I don't want to give the impression that I'm against them. Often, a patient has specific traits that make a medicine outside this list more suitable. There are other options too, like PP4 inhibitors. It's a complex name, but worth mentioning as it's among these effective medications. Insulin itself is frequently recommended. I'm not against using insulin. Ideally, type 2 diabetes is reversed before insulin's needed, but insulin can be useful, depending on contraindications to other drugs. There's another medication called pioglitazone. Some drugs increase insulin secretion, others improve insulin sensitivity, so there are various other options. Remember, many medications can be combined. We don't want to mix too many drugs, but rather help patients understand diabetes. Still, it's an option. I've even combined diabetes medications. Many think it's one drug or another. Oh, I want to switch. Often, lower doses of two drugs work better than one high-dose drug. This applies in medicine too. Don't think only one drug is good, or there are just 2 or 3 options. There are many choices. Personalization and risk factor management are key. Now, learn to lower blood sugar naturally. Relying solely on medication is a big mistake. How will you do this? How will you access this info? I made a video with tips to control blood sugar naturally. Click here to watch that video. I suggest you watch it. You know, I don't like discussing drugs. Here are tips on diet and healthy habits for diabetics. These help control with fewer side effects. Click here to see that video. Take care. Until next time.